that's part of our job, and we failed as healthcare professionals in the overall field because we haven't educated women about that. And probably a lot of times what you hear, you'll see this in your practice, I'm sure, these women have been to multiple doctors and they say, oh, as you get older, this is just normal.
Mm-hmm. Mm-hmm. Yeah, there's just that general thing of, this is just what you need to accept. And thankfully, there are a lot of women out there, and there are a lot more doctors and, people like you two that are having that conversation and making sure that women know that just because it's common and happens to a lot of women doesn't mean that it's normal, and doesn't mean that you need to accept it as inevitable, that there's nothing we can do, because there's lots of things that we can actually do. So being able to come out and have that education with them and talk about it with other providers too, because, we talked about this at the M Factor. We don't get trained in this in school. Whether it's MD, DO, and DMP, none of us get trained in this. We have a brief little thing about menopause, and we talk a little bit about osteoporosis and the increase in heart disease, but most of it is, more focused on the reproductive years, which are also very important, but we need to also address this other transitionary period that is a huge part of a woman's life, and we're living a third or more of our life in menopause. So to be able to address that properly and treat that transition and make sure the woman continues to be healthy and happy and vibrant through that, I think is a vital part that we're really missing from the education.
Yeah, I will speak for my education, but I had a 1 hour, 50-minute lecture on hormones for women, and it was Premarin only. That's basically what we learned. And we didn't learn anything about men, but we didn't learn about nothing about testosterone for women, nothing about progesterone for women. We learned about medroxyprogesterone acetate for women. So yeah, it was a one hour course.